Hi, this is John McMath with the Sciatic Pain Terminator, and I wanted to talk to you about what a disc herniation was and how it affects you in a very basic sense. So we have, as you can see, a spine here, and you have L4, L5, and S1, so we'll use these as an example because typically these are the three in the lumbar region that herniate the most. So what happens typically is if a disc is either bulging or herniate, it presses on this nerve root here. You see how a narrow opening, and then depending on which level it's herniated or pressing on the nerve is where it's going to feel. For example, if it's in L4, L5, it's going to be more towards where you can't do the stand on or walk on your heels. If it's at L5, S1, you can't do a calf raise, for example. Those are some neurological symptoms. And then also you have the dermatomes of where it feels too. L4, L5 would be more on the big toe side. L5, S1 is more on the small toe side, for example. And then in my case, since I have 6 lumbar, that's of course an entirely different set of symptoms. So you want to be sure that you don't have either 4 or 6 lumbar, because 10% of us do have either 4 or 6. And you want to verify what those symptoms are, that you do have 5, because again that could change where your pain patterns are. And what would be even worse is, let's say it is confirmed you do have a herniation, it is compressing on one of these nerve roots. You could, if the surgeon is unsure how many vertebrae you do have, you could have a surgery on the wrong level. So obviously we don't want that to happen. So again, just to recap, whenever these discs either herniate, an annular tear, which is where the nucleus leaks out, anytime you irritate these nerves, and again if it's the left side, obviously it'd be down the left, right it'd be down the right. If it's in the back, that's where you lose the bladder and bowel movement, and that's where you want to go to a doctor immediately, get an MRI, probably emergency surgery if it's a herniation through the back. But more often it's through the sides, and that's why you get the pain down either side depending on which level of herniation and which nerve is irritated. So hope that helps. If you have any comments or questions, please leave it on the blog or email me personally. This is John McMath from the Sciatic Pain Terminator, wishing you and your family a pain-free lifestyle.